Hi everyone, we are from Group 6. My name is Diorama Huga F.
And my name is Raihan Akram A.
And my name is Muhammad Fathurrijal.
And we are going to present about borderline personality disorder or BPD. Borderline personality disorder or BPD is a condition that arises as a result of disruption of a person's mental health. This mental health disorder impacts the way of people think and feel about themselves and others. It is also causing problems function in everyday life. It includes self-image issues, difficulty in managing emotion and behavior, and also a pattern of unstable relationship. Person with PPD has intense fear of abandonment or instability, and they may have difficulty tolerating being alone. Yet, inappropriate anger, impulsiveness, and frequent mood swings may push others away, even though they want to make a loving and lasting relationship. This behavior will push others away. Next is the causing of BPD. Until now, the exact cause of BPD has not been clearly identified, but this mental health may be linked to genetics. These personality disorders may be inherited among family members, and some research has shown that this personality may happen because of brain abnormalities. Changes in certain areas of the brain involved in emotion regulation, impulsivity, and aggression. And furthermore, certain brain chemicals that help regulate mood, such as serotonin, may not function properly.
The next is the symptoms of BBD. Fear of being abandoned. People with BBD are often terrified being abandoned or left alone. The example is when you have someone that you love, or maybe you have a girlfriend or boyfriend that he or she is not texting you or calling you, you will feel fear, unhappy, unpleasant, or anything. This can prompt frantic efforts to keep that person to keep in touch with you. Maybe you beg to them or her or he, cling, maybe start a fight too, and you track your love activity, and maybe you can physically block the the people being out from you. Second is extreme mood swings. Unstable emotion and moods are common with BBD. One moment you feel happy, but then you will feel sad, unhappy. Then you have much mood swings. Little things that other person do that make you unhappy can make you feel angry. These mood swings are intense, but they are just a few minutes or hours. The third is self-harm. Self-harm is activity that can hurt ourselves or yourself. Suicidal behavior and deliberate self-harm is common in people with BBD. Suicidal behavior includes thinking about suicide, making suicidal gesture or threats, or actually carrying out a suicide attempts. Self-harm encompasses all other attempts to hurt yourself without suicidal without suicidal intent. Common forms of self-harm include cutting and burning. The last is chronic feeling of emptiness. People with BBD are often talk about their emptiness. Maybe they have a hole or a void inside of inside of their body, their feelings. At the extreme, they feel nothing or nobody. This feeling is uncomfortable, so you may try to feel that thing with maybe sex, drugs, foods, or another else that can make you satisfied with that. But nothing feels truly satisfied. Next is treatment for BBD. First is physical therapy. There are lots of different types of physical therapy, but they are involved taking time to help you get better understanding how you think and feel. Physical therapy will listen and discussing important issues with you. Physical therapy can suggest ways to resolve problem, and if you ask if you ask them, or if they want to give you help, they can maybe they can change your attitude or behavior. Therapy for BBD aims to help people get a better sense of control over their thoughts and feelings. Second is medicines. Experts are divided over whether medicine is helpful. No, there is actually no medicines that are licensed to treat BPD. BPD. Medicine is actually isn't recommended by NICE, National Institute for Health and Care Excellence, because there are evidence that it may be helpful for certain problems in some people. Medicines are often used if you have BPD like anxiety disorder or bipolar disorder. The third is you can use MBT, mentalization based therapy. Another type of physio- another type of psychotherapy. MBT is based on the concept that people have bad BPD have to wake up their mentalize. Mentalization is the ability to think about thinking. This means examining your own thoughts and beliefs and assessing whether they are useful, realistic, and based on the reality. For example, many people with BPD will have sudden urge to self-harm, to harm themselves, and then fulfill that urge without questioning. The lack of the lack of ability to step back from that urge and say to themselves, that's not a healthy way of thinking. I am only thinking this way because I'm upset. Another important part of mentalization is to recognize that other people have their own thoughts, emotion, and beliefs, wishes, and needs. And maybe person with BBD interpretation is not correct. So, in addition, you need to be aware of the potential impact your action will have on other people's mental states.
So in this psychological therapy, I'll tell you about dialectical behavior therapy, or we could also call it DBT. So DBT is a therapy that helps you uh, to help you reduce your problem in social uh, relationship, or it can help you maintain your negative emotions. So this kind of therapy is including in types of CBT, or cognitive and behavior therapy. So CBT is focused on how you identify, or how you transfer your negative emotion to positive ones. And you can done this DBT with individual or with a group, uh, with a therapist. So in individual, you will ask by your therapist for about your problems in your last weeks. And then your therapist will also invite you to overcome your post-traumatic stress response, and increase your price and self-image. And the group one is learning for capabilities of receiving and changing self-behavior. And the activity generally lasts for 2.5 hours. A literature study discussed that this therapy is being effective for disorders such as depression, anxiety disorders, and other emotional difficulties. The four capabilities are: patients are invited to study the practice of mindfulness DBT teach for capabilities to accept and change self. This emphasizes the ability to focus on the awareness of the present and to accept the mind, feelings, actions, and sensation of the body without having to control or manipulate it. Furthermore, the patient obtained teachings about the difficulty of tolerance, where they learn how to overcome when the crisis and accept the situation instead of thinking about the situation that should have happened. Patients also been about emotional regulation skills and personal effectiveness. When they are taught the skills to regulate emotion, patients come to understand that they should not let their emotion control themselves. Meanwhile, personal effectiveness lessons allow patients to convey what they need or want, and how to receive interpersonal conflicts while still respecting themselves and others. And maybe after all the therapy and treatment you get, here are some friendly reminder you can remember this. The first one is always being optimistic about life and not afraid to face failure in a way to avoid getting caught up in personality disorders. And don't forget to always think and behave positive in dealing with the problem. And if you have a problem, you can talk it with your family, with your close friends, or with your relatives. Uh, and maybe it can help you to solve the problem in a positive way, and always be in a positive environment uh, to help with the recovery process from BPD. And that's from our presentation today. If there's anything missing, uh, feel free to discuss it with us. And thank you for your attention.